This is the digital channel of the General Overseas Service of All India Radio. I am Manoj Mainkar, and in the next half hour, I'll bring to you news updates from India and around the world, awareness videos on coronavirus by Government of India, yoga on radio, and a lot more. We'll begin with the news updates.
This is the General Overseas Service of All India Radio. The news read by Maria Albina Michael. The BCCI on Thursday suspended the 2020 Indian Premier League till further notice, a decision that was conveyed to the franchisees a couple of days back and was expected after the lockdown to combat the COVID-19 pandemic was extended. PTI reported on 14th April that the 8 franchisees, along with other stakeholders, had been intimated about the indefinite postponement of the event, which was originally planned from 29th March. The board on Thursday said that given the evolving global health concerns and lockdown measures implemented by the government, it had no choice but to further postpone the Glitze T20 League. The IPL Governing Council of the BCCI has decided that the IPL 2020 season will be suspended till further notice, said BCCI Secretary Jay Shah in a statement. As many as 270 British nationals who were stranded in Punjab and some other states after the centre imposed a nationwide lockdown to combat the coronavirus outbreak were airlifted in a special flight from Sri Guru Ram Das Ji International Airport on Thursday. The special flight to Heathrow Airport was arranged by the British government, they said. The British nationals were stranded in Punjab, Rajasthan and Jammu and Kashmir, they added. Meanwhile, UK government has extended the lockdown till 7th May as part of the country's fight against coronavirus. UK Foreign Secretary Dominic Raab announced the decision after the cabinet meeting. He said that the social distancing measures will remain in force for at least next 3 weeks. The announcement came in the midst of a rise in the deaths due to the pandemic. The confirmed coronavirus death toll in the United States reached 32,917 on Thursday, according to a tally by Johns Hopkins University. The toll as of 8:30 p.m. marked an increase of 4,491 deaths in the past 24 hours, by far the highest daily toll in the pandemic so far. But the figure likely includes probable deaths related to COVID-19 which were not previously included. This week, New York City announced it would add 3,778 probable coronavirus deaths to its toll. As of Thursday night, the U.S. Centers for Disease Control and Prevention had recorded 31,071 coronavirus deaths, including 4,141 probable virus deaths. The US has the highest death toll in the world, followed by Italy with 22,170 dead, although its population is just a fifth of that of the US. The World Health Organization's European office said Thursday that despite some optimistic signs in some of the countries worst hit by the new coronavirus, the number of cases was rising and approaching 1 million in the continent alone. We remain in the eye of the storm, said WHO Regional Director for Europe, Hans Klug, at a news conference, noting that about half of the worldwide confirmed cases were in Europe. Klug noted they had seen positive signs in terms of declining numbers in Spain, Italy, Germany, France, and Switzerland. However, he said the positive signals in some countries were overshadowed by sustained or increased levels in other countries such as Britain, Turkey, Ukraine, Belarus, and Russia. Stuck on board cruise vessels across the globe, about 25,000 Indian crew members need to be brought back home immediately, a leading maritime body said on Thursday as it mooted the idea of hub ports. With cruise operations unlikely to resume in the near future amid the global coronavirus pandemic, India needs to think beyond tomorrow with urgency in the interest of its seafarers, it said. India needs to work with the Europeans towards creating such hub ports which will not only help in controlling crew changes but also assist in resurrecting the local economy, at least in the service sector, the maritime body added. There are about 15,000 Indian seafarers on board around 500 cargo vessels across the globe, in addition to 25,000 on cruise ships. The US has provided nearly $5.9 million in health assistance to India to contain the spread of COVID-19, the State Department has said. The amount is being used to help India hinder the spread of the disease by providing care for the affected, disseminating essential public health messages to communities, and strengthen case finding and surveillance, it said on Thursday. The assistance is also being used to mobilize innovative financing mechanisms for emergency preparedness and response to the pandemic. This builds on a foundation of nearly $2.8 billion in total assistance, which includes more than $1.4 billion in health assistance the United States has provided to India over the last 20 years. It said in an update of the US efforts in response to the COVID-19 pandemic. India has decided to supply anti-malarial drug hydroxychloroquine to 55 countries. Government sources said out of these, 21 countries will get the drug on a commercial basis and other countries will receive it on a grant in very small quantities. Sources said the total number of Indians infected with COVID-19 abroad is 3,336 from 53 countries. 25 Indians died abroad due to the disease. They also said India will soon get COVID-19 testing kits from South Korea. Indian missions have also taken quotations for testing kits from vendors in the UK, Malaysia, France, Germany, Japan, and the US. They are coordinating with major agencies for PPE kits, and country will soon get a huge consignment of PPE kits. The Union Home Ministry on Thursday asserted that rules such as wearing face masks, practicing social distancing, and no gathering of 5 or more persons should be strictly enforced at public places in order to ensure that the lockdown clamped to contain the spread of coronavirus in the country is implemented effectively. Addressing the daily media briefing, Joint Secretary in the Ministry, Punya Salila Srivastav, said it should be ensured that 5 or more persons do not assemble at a public place. Elderly people, those who are not keeping well, and those with young children should be encouraged to work from home, and temperature screening as well as use of hand sanitizers should be made mandatory at workplaces, Srivastav said. Government has said that 325 districts in the country have not reported any coronavirus case so far because of actions initiated at the field level. There are 27 other districts also where no positive case has been reported since the last 14 days. As per the Health Ministry data, 1,320 fresh confirmed cases of COVID-19 have been reported in the last 24 hours. As many as 1,749 patients have recovered and discharged from the hospitals, while 437 patients have died so far, and the total number of confirmed cases is 13,387. Briefing media in New Delhi, an official from Health Ministry said the implementation of containment strategies in some districts which had earlier reported COVID-19 cases have yielded positive results. One of them is Mahe district of Puducherry, which has reported no case since the last 28 days. And that is the end of this news bulletin.
If the current COVID-19 outbreak has got you feeling stressed out and anxious, then a calming yoga flow can definitely help. We care for your well-being and therefore, we bring for our listeners Yoga on Radio. Practice some easy asanas with Yogacharya Surakshit Goswami and keep yourself healthy and rejuvenated.
listeners, today we will practice Setubandhasana. Setubandh or bridge pose gets its name from the Sanskrit words Setu, which means bridge, Bandha, which means lock, and Asana, which means pose. This pose resembles the structure of a bridge and therefore it is named as such. This pose stretches your back, neck and chest and relaxes your body. It is an excellent asana to keep diabetes under control. Doing Setubandhasana regularly boosts the functioning of the thyroid gland and keeps the lungs and heart healthy. The asana also strengthens the back muscles, knees, legs, neck and chest, relaxes the whole body, reduces stress, calms the brain and reduces anxiety. The asana is good for pregnant women. Besides improving digestion, the asana also cures back pain and insomnia. Setubandhasana maintains normal blood pressure and improves blood circulation. Precaution: avoid Setubandhasana if you are suffering from pain or cervical spondylitis.
This asana pose resembles a bridge, hence the name Setubandha Asana. Lie on your back. Bend your legs at the knees, keeping the heels as close as possible to the hips. Hold your ankles with your hands if possible, or else place your palms on the floor beside your hips. Inhale and lift up your back and hips very slowly and smoothly so that your chin touches your chest. Keep your shoulders and heels planted on the ground. Close your eyes and focus on your heart. Hold this posture for as long as possible while breathing normally. Return to the original position very slowly and relax. Repeat this asana 3 times.
Now, it's time for today's commentary.
Advancing India's Act East outreach amidst the COVID-19 global pandemic, Prime Minister Narendra Modi discussed public health governance and economic challenges with key strategic partners including Vietnam, Japan and Republic of Korea. After demonstrating decisive leadership in bolstering South Asian Association for Regional Cooperation in combating COVID-19, the Indian Prime Minister joined forces with key anchors of India's Act East policy to explore new vistas of cooperation. Earlier this week, Prime Minister Modi engaged in a telephonic conversation with his Vietnamese counterpart Nguyen Huan Phuc with the objective of enhancing bilateral cooperation, including facilitating supplies of necessary medical equipment to battle COVID-19. As India looks to import personal protection equipment PPE kits, suppliers based in South Korea having tie-ups with production companies in Vietnam has been identified. Vietnam has so far showcased resilience in its fight against the pandemic with relatively low number of positive cases and no reported fatality despite sharing borders with China. Strict border control, robust health governance and enhanced awareness through technology platforms helped Vietnam in its fight against COVID-19. In addition, Vietnam currently holds Association of Southeast Asian Nations ASEAN chairmanship and steered the special ASEAN Plus 3 summit on April 14. During this meeting through video conference, Vietnam called for multi-sectoral, multi-stakeholder, whole-of-community approach to address the multidimensional challenges posed by COVID-19. During the exchange, the two leaders also discussed shared strategic interests. Vietnam is India's comprehensive strategic partner and an important pillar in Delhi's Indo-Pacific strategy, advancing rules-based order. Moreover, economic cooperation is an important pillar in the bilateral relations. India features as one of Hanoi's top 10 trading partners. Within ASEAN, Vietnam is the second largest export destination for India following Singapore and the fourth largest trading partner following Indonesia, Singapore and Malaysia. Mr. Modi had earlier spoken with Japanese Prime Minister Shinzo Abe. The two prime ministers urged the India-Japan Special Strategic and Global Partnership should focus on developing new technologies and solutions for the post-COVID-19 world. Japan has expanded the state of emergency due to coronavirus throughout the country. As of April 15, Japan had 8,100 positive cases as per Japan's Ministry of Health, Labor and Welfare. Tokyo has registered most number of cases by Osaka. The biggest setback inflicted by COVID-19 on international sports is the postponement of the much anticipated Tokyo Olympics 2020. It has been rescheduled to July 23rd to August 8th, 2021. Meanwhile, Japan has helped developing economies to deal with the pandemic. For instance, it extended a $1.86 million help to Vietnam through international organizations. Japan has also offered antiviral drugs for free to 20 nations to deal with this global health emergency. Prime Minister Narendra Modi also reinforced India-South Korean cooperations on COVID-19 during his telephonic discussions with President Moon Jae-in. South Korea is already facilitating supplies and transport of medical equipment sourced by Indian companies. South Korean technology-based trace, test and treat model to contain the outbreak of COVID-19 has been appreciated worldwide. South Korea opted for extensive testing. As many as 18,000 tests each day could be possible as Korean bio companies promptly develop testing kits. As India looks at importing such kits, South Korea offers opportunities. 9 Korean companies have got export licenses for the test kits. As India, together with the world, grapples with this pandemic and prepares to manage the economic implications triggered by severely disrupted global supply chains, the Indian Prime Minister has stepped up India's leadership role in deepening cooperation with strategic partners in the East. Commerce, connectivity and culture have been defined as India's eastward strategic engagement. With new dimensions of challenges like COVID-19 facing humanity, India is working and coordinating with its partners to devise a robust and coherent approach to fight the pandemic while managing the risks to public health governance and economic stability.
India is at a critical stage in its fight against coronavirus as fears of community transmissions rise. During its lockdown, frontline workers are still going out every day to win what one doctor described as a war India can't afford to lose. In this section, we bring to you the best of advices from doctors all over India talking about various aspects of coronavirus. Here is one such doctor talking to you.
I am Dr. Nobu. As we all know, they're going through a very bad page in history, suffering from a virus disease, what is known as COVID-19, which has assumed pandemic status. WHO has declared it on 11th of March as pandemic disease. It has involved 180 countries throughout the world. In our country, to contain this disease, our Prime Minister Shri Narendra Modi has taken the lead and have issued some advisory for us. Like the country has been brought under lockdown to contain this disease, and we have been advised to practice social distancing. We have been advised to wear mask. We are advised to wash our hands very frequently and to respect the activities that are being carried by our healthcare staff, the police, the media, and everybody to save our lives. The logic behind all these advisories are this virus, when it comes into us, this has come from an animal origin and has assumed the power of transmitting from human being to human being. When such a patient coughs or sneezes, it throws aerosols containing all this virus up to a few feet. Then this virus drops wherever you are sitting, maybe on the table, maybe on the railings, maybe on the clothes. It survives there for a few hours, sometimes more than 72 hours. And therefore, social distancing is advised, wearing masks is advised, frequent washing of the hands and feet are advised. So if we practice all the advisories very sincerely, then we think that we can contain this pandemic in our country very fast and very effectively.
During lockdown in India, many citizens are voluntarily participating in creating awareness and helping the less privileged.
We all are going through very difficult times. In fact, the entire country is fighting a war against coronavirus. So I would request everyone to cooperate with the Government of India and the state government guidelines. So please stay at home, stay safe, stay fit, and most importantly, stay positive.
Namaskar. My name is Shruti and I'm an HR, a handwriting analyst, a radio presenter, and a community servant. But none of this will matter, if we do not help our world revive from this COVID-19 pandemic. The world is suffering and so is India. Today, I want to talk to you as a responsible citizen of India and request you to please come forward and support our nation in the time when we have to look beyond boundaries, beyond our religion and our community. We have to take responsibility and in our small little way, do whatever we can. I think the first and foremost is educate yourself with what COVID-19 is. Stop reading the fake and unauthenticated news. Try and follow the news which is from WHO, UN or Government of India. Stop forwarding those fake newses. I think a lot of damage is being done because of the fake news and misinformation which is floating around. If you can stop, please do so. It is not our moral responsibility to forward every forward that we receive. The other thing that we can do probably right now is to contribute to the community. There are a lot of people who are not as privileged as we are. I think we need to come forward and support them. If you could donate money, if you can donate goods in kinds, please do so. Our nation needs all of us. It's time that we need to come together and save humanity beyond the boundaries. Thank you so much.
The world is grappling with possibly the worst public health crisis seen in more than a century. The COVID-19 pandemic has gripped nations, compelling governments to impose countrywide lockdowns to contain the spread of the deadly virus. Government of India is taking all necessary steps to ensure the well-being of its citizens. The most important factor in preventing the spread of the virus locally is to empower the citizens with the right information and taking precautions as per the advisories being issued by Ministry of Health and Family Welfare and World Health Organization. We share with you one such advisory. Have a look.
The COVID-19 pandemic has affected all of us and causes a lot of fear and panic and of course stigma. What are the 5 ways in which we can reduce stigma? The first, use proper terminology. Use terms like affected by COVID or recovering from COVID rather than the terms victim. Number 2, make sure that you do not disclose information about people who are affected by the illness or who've been quarantined, and be supportive to them. Number 3, avoid sharing rumors which are unauthentic information. Make sure you go to the Ministry of Health and Family Welfare or WHO website to have the proper information about the illness. Number 4, do not create panic and fear. Do not use words like the world is going to end, all of us are going to die. Instead, share positive stories of people who are recovered and people who are helping each other. And finally, a plea to decrease stigma is to make sure that you enable health workers, sanitary workers and the police to work respectfully.
This broadcast came to you from the digital channel of the General Overseas Service of All India Radio.